Hi students, let's learn how to read ECG. ECG made easy.
Good morning, everyone. Today we will discuss electrocardiography, commonly known as ECG, and we will also study different types of arrhythmias and their management. The ECG is one of the most important diagnostic tools in cardiology. It is simple, non-invasive, inexpensive, and provides valuable information about the electrical activity of the heart. By the end of this lecture, you should be able to define ECG, understand the ECG procedure, identify basic ECG waves and intervals, learn a systematic approach to ECG interpretation, recognize common arrhythmias and their management. An electrocardiogram is a graphical recording of the electrical activity of the heart over time, obtained using electrodes placed on the skin. The heart generates electrical impulses that stimulate contraction of the cardiac muscle. These electrical signals are detected by electrodes and recorded as waves on ECG paper. ECG is used to diagnose conditions such as cardiac arrhythmias, myocardial infarction, conduction abnormalities, electrolyte disturbances, cardiac enlargement. To understand an ECG, it is important to first understand the cardiac conduction system. The electrical impulse that controls the heartbeat begins in the sinoatrial node, which acts as the natural pacemaker of the heart. From the sinoatrial node, the impulse spreads through the atria, causing them to contract. It then reaches the atrioventricular node, where the signal pauses briefly before continuing its pathway. After this delay, the impulse travels through the bundle of His, then passes into the right and left bundle branches, and finally spreads through the Purkinje fibers. This organized flow of electrical activity leads to the coordinated contraction of the atria, followed by the ventricles, and these electrical events are recorded as waves on the ECG. Components of an ECG. The ECG tracing consists of several waves and intervals. P wave. The P wave represents atrial depolarization, which leads to atrial contraction. PR interval. The PR interval represents the time taken for the electrical impulse to travel from the atria to the ventricles through the AV node. Normal PR interval is 0.12 to 0.20 seconds. QRS complex. The QRS complex represents ventricular depolarization, which causes ventricular contraction. Normal QRS duration is less than 0.12 seconds. ST segment. The ST segment represents early ventricular repolarization. Elevation or depression of the segment may indicate myocardial ischemia or infarction. T wave. The T wave represents ventricular repolarization when the ventricles relax.
Now let us discuss the procedure of recording an ECG. Preparation of the patient. First, the procedure should be explained to the patient to reduce anxiety. The patient is asked to lie in a supine position on the examination table. The chest area should be exposed while maintaining patient privacy. Metal objects, such as jewelry, should be removed. The skin is cleaned with alcohol swabs to improve electrode contact. If there is excessive chest hair, the area may be shaved. Electrode placement. A standard ECG uses 10 electrodes to obtain 12 leads. Limb leads. 4 electrodes are placed on the limbs: right arm, right leg, ground electrode, left leg. Chest leads. 6 electrodes are placed on the chest: V1, fourth intercostal space, right sternal border; V2, fourth intercostal space, left sternal border; V3, between V2 and V4; V4, fifth intercostal space, mid-clavicular line; V5, anterior axillary line, V6, mid-axillary line. Recording the ECG. After electrode placement, the ECG machine is connected to the electrodes. The patient is asked to remain still and breathe normally. Movement can cause artifacts. The machine records the electrical activity and prints the ECG tracing. The recording is labeled with patient details and time of recording.
1. Sinus bradycardia. Sinus bradycardia is a heart rhythm originating from the sinoatrial node, SA, with a heart rate less than 60 beats per minute while maintaining a normal conduction pathway. 2. Sinus tachycardia. Sinus tachycardia is a normal sinus rhythm in which the heart rate exceeds 100 beats per minute, usually due to physiological or pathological conditions such as fever, exercise, anxiety, or dehydration. 3. Atrial fibrillation. Atrial fibrillation is an arrhythmia characterized by rapid, irregular electrical activity in the atria, resulting in an irregular ventricular rhythm and absence of distinct P waves on the ECG. 4. Atrial flutter. Atrial flutter is a type of supraventricular arrhythmia caused by rapid and regular atrial contractions, typically producing sawtooth-shaped flutter waves on the ECG. 5. Ventricular tachycardia. Ventricular tachycardia is a fast heart rhythm that originates from the ventricles, usually with a heart rate greater than 100 beats per minute and wide QRS complexes, and it can be life-threatening if not treated promptly. 6. Ventricular fibrillation. Ventricular fibrillation is a severe and life-threatening arrhythmia characterized by chaotic and disorganized electrical activity in the ventricles, leading to ineffective heart contractions and absence of cardiac output.